Hello everyone, my name is Pino and I am a current student here at FSU Panama. The purpose of this video is to raise awareness on the issue of how the pandemic had a great impact on the mental health of the healthcare workers and the healthcare system and environment overall. So in the following video, you're gonna witness two short interviews with two doctors and a third interview that acknowledges the fact that family members of doctors were also affected by this issue. So come along with me and hope you enjoy the video. Bye! What is your name? Where do you work at? And what is your profession?
My name is Lillian Cohen and I work for the Panamanian government in the Social Security, and I also work at Punta Pacifica Hospital, which is a Johns Hopkins branch in Panama City. I am an anesthesiologist and I work mainly in the operating room.
In 3 words, describe what it's like being a doctor.
For me, being a doctor is challenging, fulfilling, and exciting.
So tell me a little bit about how it was working in the pandemic. Comment on some of the challenges you faced by working as a doctor during COVID-19.
Definitely the pandemic were trying times for everyone. A little more so maybe for physicians in a way that we had to deal with death in a more hands-on way maybe, and we had to deal with the pain of the relatives. So it was not only the stress of our work that we had to deal with, but also the stress of our family members being quarantined at home. We definitely had to find ways to counteract that and to relieve the stress.
Have you ever suffered from what is known as a physician burnout?
No, personally I have never suffered from burnout.
What advice would you give to doctors out there that are struggling with mental health issues due to feeling overworked?
All my physician friends or colleagues that are dealing with mental health issues, I would definitely recommend them to seek help. First of all, with a professional, with a psychiatrist or a psychologist, and to seek some help from their family members, to lean on their family members and their friends, and to definitely look for some ways to diminish the stress, like maybe finding some exercise that they would enjoy doing, or maybe spending some time in contact with nature. That would really help.
What is your name? Where do you work at? And what is your profession?
Hello, my name is Dr. Nelson Cedeño. I work at the Hospital Nacional and Panama Clinic as a orthopedic surgeon and super specialist in spine surgery.
In 3 words, describe what it's like being a doctor.
Best job ever. 3 words.
So tell me a little bit about how it was working in the pandemic. Comment on some of the challenges you faced by working as a doctor during COVID-19.
During the pandemics, as a orthopedic surgeon and spine surgeon, was a very challenging work, because we have to deal with an infection disease, and most of the time life-threatening, and a urgent surgery, and we have to deal with what do first: treat the infection or treat the injury, say fracture or lumbar hernia or something, and keep us safe and keep my teamwork safe too. So it was a very hard moment in the life of surgeons.
Do you consider your profession stressful? And how did that stress change during the pandemic?
As a doctor, we are always exposed to stressful situations, and we have to deal with it. Pandemic was new stress in the life of every every doctor. Personal, I don't have. I didn't had a mental stress above the normal, but it was a strange situation.
Have you ever witnessed fellow doctors deal with mental health issues due to the profession of being a doctor?
During my fellowship, I saw some partners in surgery and urologists that they went in depression and was treated with the psychiatrist because the amount of work was too much for them, and it's normal that maybe one or two of these fellows quit the fellowship, and it's caused by burnout syndrome or depression or mental health issues.
How are you able to manage the stress that comes with your work?
The way I manage the stress is doing exercise, sports. I do tennis, bowling, swimming, weightlifting, and flag football. Well, every time if I can. But doing sports, I feel good, I feel alive, and this is the way I manage the stress of my work. And but in generally, we have to do what give us pleasure. Maybe music, maybe cook, maybe travel.
What is your name and your age, and what do your parents do for work?
Hi, my name is Daniela Semena. I am 21 years old. My mom's name is Lillian Cohen, and she's a doctor as well as my father.
Do you like the fact that your mom is a doctor?
I do like that my mom is a doctor because I think that I have learned a lot from her, and she has taught me a lot of things of her work, and I wish I could be as successful as her.
What are some lessons you have learned from your parents being doctors?
Some important lessons that I've learned from my parents are that to get that successful, it takes a lot of time and a lot of work, and you have to be patient and you have to have a lot of courage.
From personal experience of seeing your mom and dad, do you feel that the medical environment is somewhat demanding?
I do think that the medical environment is very demanding, but I think that people that are doctors are born for the job.
During the pandemic, do you felt like your mom was being overworked due to the fact that she was out there helping everyone?
I do feel like when my mom was working with the pandemic, she was overworked because she had to wear like a specific outfit to go to work, and it was a very, very exhausting routine that she had, and I think that it was difficult not only for her but every doctor. I felt proud of my mom because it was a really hard time for everyone, and she was working so hard, and I know that she was happy because she was able to help so many people, but also very stressed at that time because not much could be done.
From your perspective, do you believe that the mental health factor in a doctor's environment is sometimes overlooked and not put as a priority?
From my perspective, I know that the mental health factor in a doctor's environment is not overlooked because, at least here in Panama, my mom has told me that her workplace is a very healthy environment, and she has friends and doctors that help her, and she has told me that they usually help each other, and they talk and they share those hard moments.
What would you say to people that don't know how hard and demanding this profession is?
I would like to say that clear out that this profession is really for people that are born to do it. It is for people that are really passionate about medicine and people that know that being a doctor is it's not just operating or going to a hospital. It takes more than that. It takes a lot of your time, and I think that people should know that, and I would like to see more supporting of the topic. I think that more people should hear about this and more people should raise awareness about this topic, because I think it is important for people to know how mental health is important for doctors.